I bet that most of you guys start studying when you hear about the exams. We sit to study and tell to ourselves today that I will learn up to this and nothing is going to stop me. But after some time, everything is going to be same for us. Everyone is like that. But remember that nothing changes if nothing changes. We should believe in ourselves. We can say that we can do it. We have to cut that T and say that I can do this. Trust the process that you are doing. It will bring success to us. And don't be afraid to fail. Be afraid not to try. So let us begin today's discussions. Welcome back, guys. So we are discussing about the syllabuses of KUHs of MBBS. So today we are going to discuss about pathology. So let's go to pathology. Pathology is a vast topic. So study using any plan. Otherwise it will be very difficult to in the last moment. It will be very difficult. So pathology, there are a lot of things to study. Course content, if I go to read, it will not end. So there are a lot of things, you know. So we will just focusing on evaluation types and mark schemes. So here is evaluation. There will be regular formative assessment. In formative assessment, day-to-day performance should be given greater importance for and forms the basis of internal assessment. So in my area, because of lockdown, there are no classes. So it will be very difficult. Then internal assessment. The internal assessment mark for pathology are 15 for for practical and 15 for theory. Since the minimum percentage required for appearing the university exam is 35%, the total minimum marks required for internal assessment would be 5.5, like microbiology, 5.5 out of 15. There should be separate minimum for practical as well as theory internal assessment. So the total marks for the university exam in pathology is 150. And the pass has to be decided as follows. The total aggregate mark should be 75 out of 150. Like previous, theory and practical internal assessment should be added to marks obtained to the marks obtained in theory and practical university exam respectively for deciding the pass. For theory, 55 marks out of 110 and 40 marks out of 20 for practicals. If moderation is given, in the event of no doubt evaluation, it should be added to the theory marks only, since the logic for moderation is ambiguously in question paper. No moderation needed to be given for practical exam. Therefore, there will be no moderation for practical exam, only for theory. Before printing, that we don't need. Then for the marks for internal assessment is for theory 15 marks including viva, practical 15 marks on exam for the theory at the end of each semester, viva to be conducted preferably with each exam. The last exam will be as per university exam pattern: theory, practical and viva. Internal assessment may be calculated as follows. For theory 15 marks, minimum 3 exams, final theory exam 5 marks, best of other 2 exams, that is 5 marks. Seminar per presentation and class tests 2 marks, viva 3 marks, practical 15 marks, and record 1 mark, histopathological, then clinical pathology and autopsy, CPC records, etc. Record to be maintained and evaluated. That is histopathology record, clinical pathology record, a common record of post-mortem findings in 10 cases, and 5 clinical pathological conferences, practicals is equal to 14 marks. So total 14 marks. Then the details of marking scheme for pathology practical would be there are lots of things. I will read. These are peripheral smear reporting, internal assessment exam marks 20, university exam is 10. Half of the is 10. Then clinical pathology 20. Then for university exam it is 10. 1 out of 6 will be asked. That is blood grouping for theory exam, internal assessment exam, it is 20, and for university exam it is 10. Urine analysis 20, 10. Spotters, that is 20 numbers, 60 marks. That is 20 into 3, 60 marks. Record 4 plus 3 plus 3, that is histopathological, clinical pathology, and CPC. This is 10 marks. For university there is no marks for record. Then total 150 marks. Then for university, total 100 marks to be converted to 15 and then to be converted to 25. This will be converted to 15 in internal assessment and 15 in internal assessment and 25 in university. Mark for record has to be added to internal assessment in practicals only and not in the university practical, since it will be the result in duplication. It will result in duplication. Those record marks will not be added. Then university examination marks breakups are: for theory 80 marks. In the theory internal assessment 15 marks and Viva 15 marks. Total for theory is 110 marks. Practical 25 marks. Practical internal assessment 15 marks. Total for practical is 40 marks, just like microbiology. Grand total for pathology is 150 marks. Pattern for theory paper, university theory paper. There will be 2 theory papers of 2 hours duration. The theory papers for university are paper 1 40 marks and paper 2 40 marks. The content area would be paper 1, that is clinical pathology. Topic for paper 1 is the clinical pathology. Disease aspects of hematology will be included in paper 2 only. Then general pathology, paper 2 topics are systemic pathology and hematology. So the detailed pattern of a theory questions: out of 40 marks for each paper, the marking scheme would be answer in single sentence 4 into half, that is 2 marks. Structured essay 6 marks. Short answer question 8 marks. Structured essay then again 8 marks. Write short notes on, then this is for 4. There will be 4 questions for 4 marks each, that is 16 marks. Section A and B are needed in each paper only if there is no double valuation, so that each examiner can value one paper. If there is a section A and section B, then the marking scheme for each paper will be as follows. What are these? Paper 1. Paper 1, section A. Single word type 2 marks. Problem based structured essay 6 marks. Short answer question 4 marks. That is for 4 questions 8 marks. A short note 1 question 4 marks. Section B, standard or modified. And for paper 2, then again like that earlier. For section B, standard modified 8 marks. Then essay, short answer question 4 into 4, that is 12 marks. Practical OSPE, total 25 marks for practical. No marks for record in the university practical. Practical marks to be split up as follows. Procedural stations 4. Procedural stations are 4, that is 15 marks. Response station or spotters, that is 20 stations, that is 20 spotters will be there for 10 marks. Then procedure stations 15 minutes per station, that we all know. The teachers will ask questions like that. Then urine analysis procedure means teacher will not ask questions, that we have to do our practicals. Questions can be asked during the procedure. Blood grouping, teachers may ask questions. Then for urine analysis, including sediments demonstrated as charts, peripheral smear preparation, thick and thin, staining, HB estimation, TLC, ESR, PCV, peripheral smear reporting. Then HMA, AML, CML, neutrophilia, eosinophilia. Then for response station, that is spotters, 2 minutes each, 20 stations with questions. Specimen mounted and wet 7 specimen mounted and wet. Specimen mounted and wet 7. Histopathological slide 6. Hematology slides 2. 1 bone marrow. So bone marrow will be there. Cytology slide 1. 20% should be with the clinicopathology correlation, that is 4 spotters in CPC. Then histogram interpretation 1. Interpretative clinical pathology chart with photos 1. Clinico-pathological correlative exercise specimen slide combinations with the clinical history. One instrument will be there. Equal to 1. Viva 15 marks. Therefore, total 4 sessions for Viva. Stations will be for clinical pathology and hematology, general pathology, systemic pathology 1, systemic pathology 2, and pathophysiology of pain. Practical guidelines. What are the practical guidelines? That we had to, these are the things that we had to draw in our practical record. Then these all things, there is no need to, these are all related to how to study, what are the things we have to study, that you can look. I just mentioned we have to give importance about what are things we have to give importance for practical, and what are the mark distributions. So all the best. Study accordingly. Plan your way to study yourself. So in the next video we will be talking about the syllabus of pharmacology. So thank you very much. If you like the video, please subscribe and share it to your other friends so that they can also have a good idea about what are the things they should study or how they should prepare for exam. Wow.